Hello, I'm Ruth Hansten. Welcome to the Relationship and Results-Oriented Healthcare Professional Practice Certification Program. What I'm about to do is to give you some visual orientation related to the program and how you'll proceed and some of the materials that you'll have available to you. First of all, you should have received an agenda that looks something like this. About a week before every one of our calls, you will be receiving an agenda that will discuss what kinds of concepts we'll be discussing, what things you should be prepared to discuss with the rest of the folks that join us. Now, in this case, this also gives you the call-in number, the number also that you can call in for the recorded conference calls. And in this particular set of agendas, there's a listening skills assessment as well as some manners about being involved in teleconferences. Okay, so these will be coming a week ahead. So that's one of the sets of materials that you will receive. You also should have received or will be receiving an 81-page thick portfolio. This portfolio includes your assignments. It includes some places that you can record some of your answers, worksheets, and tools that you can use, as well as a couple of articles that will help ground you and orient you. So that's another, this is what we call the portfolio. This is the thickest amount of materials, 81 pages. And oftentimes people do place those in a 3-ring binder such as this that will help them then organize their materials. You also should have received by email or in a printed format a couple of other documents with your first call agenda. One of these is what we call the quick reference sheet, and it's 2 pages, and what that has is the dates of the calls. So January 23rd is the orientation call. We have a February 6th, March 19th, April 9th, April 30th, May 21st, and after that you'll be ready to get certified. And it tells when the calls are offered by your time zone, as well as the call numbers that you can access. Also, you'll notice on the second page of this that it discusses the course credits, the 4 credit hours that you can receive from Olympic College if you want to. If you desire to do that, there's an extra fee just for the paper handling and all of that at Olympic College, but this gives the information on how you can register to get that extra credit. You should also have received the specialist guidelines. Okay, these are the guidelines for the process. And this is like your schedule. It gives you the conference call numbers again, an overview of the course, the dates, talks about how to get ready for your portfolio review. And it also gives you your schedule as to where you should be in your assignments for the coursework. So for example, January, it's page 2 of our schedule guidelines. Okay, it says schedule guidelines at the top. It says we have an orientation call. We're going through getting started. We're going to be now moving on to the second call on February 6th. We'll be having gone through some professional assessment, self-assessment of our practice, as well as starting into section 3. Okay, so this is where you get your assignments on where you should be. There are 3 pages to that document. Okay, so the schedule guidelines, you also received a quick reference sheet, you received your agenda, and you received this thick portfolio with all the main information tools worksheets. Okay? Also, you should have access to a couple of textbooks, and each organization has provided these in a different way. The Relationship and Results-Oriented Healthcare Planning and Implementation Manual, which is available on Amazon or at lulu.com, and also Clinical Delegation Skills, a Handbook for Professional Practice. This is the 4th edition that was produced in 2009, and this is also available at Amazon or Jones & Bartlett. So those are 2 textbooks that we would like you to have easy access to. So these are the materials for the course, and we wanted you to have a visual representation. We will discuss this also in our January orientation call, and we record that call. It's It's available on the free conference call line as directed in your agenda. You can call in and listen to that after we've recorded it. And we also take those calls and we place them on the student part of our website at www.hansten.com or www.rrOHC.com for rock, and you can access the student part of the website. Contact Kathy Watkins at kathy.watkins@hansten.com, kathy.watkins@hansten, hansten.com for the access codes for that student part of the website after you've registered. So let's just talk a little bit about the program and why you're involved in this. So after 5 or 6 months of working with us, we'll have some testing, and in that testing we'll have an open book review of the concepts that you've discussed. You will be receiving a pin like this that certifies you, as well as a certificate. Our program has been developed over about 6 years now of revision. What we're trying to do is to help develop people internally in each organization that can lead the charge forward to better patient care. So in this professional practice certification program, the specialists, when you've completed the course, are able to do internal consultation. In the program itself, we lead you from self-assessment, which is, of course, essential for critical thinking. That reflection piece is the way that we begin to identify our strengths and weaknesses and where we need to change. So we go from self-assessment to organizational assessment, compare our organization with others across the nation, with patient care safety practices, as well as really looking at what our state practice acts tell us we should be doing. We also have tools that we've developed and we ask you to use that will help you do some organizational and unit-based assessment on each shift. Once you've done that and you've identified some issues that you might want to pay more attention to, we've asked you to do some problem solving and to create a critical thinking project that will allow you to really make some changes that you want to see happen in your organization or your unit. And then by the end of the course, we'll be asking you to do some more evaluation. So the whole course is set up to help really cement some of these basic concepts about professional practice, teamwork, delegation, supervision, leadership, coaching, basic coaching skills, so that you can be that person who will be the go-to person on your shift about patient, family-oriented care. So just another quick bit of information about the beginning of your processes here. We talk about relationship and results-oriented healthcare, and our philosophy and method of delivering care is to base everything that we do on the patient and family's 4 Ps. So that's their purpose, their picture of success, the plan to get there, and the part that everyone plays, including the patient and the family. We believe that interdisciplinary care is not effective unless we have a shared mental model and we have a way that we can work together effectively toward the patient's goals, not ours. With that in mind then, in your coursework, you'll notice that as you begin to go into your table of contents, that we have 9 basic sections. These sections are, again, based on going from the internal assessment, organization, unit-based evaluation and assessment, to really focusing on what we need to change, changing it, and coming through with a critical thinking problem. So you'll notice we have the sections in your next 2 pages. On page 4, we give you information about how you can make yourself available those textbooks that you need, and also we recommend a couple of other textbooks if you have them available. It'd be great if you could look at those. That's Primal Leadership, Critical Thinking also. Primal Leadership is one of the Daniel Goleman emotional intelligence books. We think it's excellent. Relationships-based care by Creative Healthcare Management. We think they do a great job with explaining that. And critical thinking and clinical judgment. And this is by Rosalind Alfaro-Lefebvre, and there will be a new version coming out early in 2012. I believe sometime in January is what we're hearing now. So just FYI, that is on page 4. And then as we go through the course description and the outcomes, keep in mind that our purpose here is to help you be that internal consultant and leader that will help bring that professional practice to the highest possible level each day in your organization. So thank you for joining us for this overview of relationship and results-oriented healthcare and the professional practice specialist program that you are entering. Best of luck, and please contact us if you have any questions whatsoever. Thank you.